The top stories tonight in Y News. The Philippines records 4 new cases of the highly contagious Delta variant of COVID-19.
3 Israeli experts arrive in Manila to assist in the Philippines' COVID-19 vaccination program.
The Manila city government says that walking in for COVID-19 vaccination is already allowed in the city. A UNTV exclusive, administrative cases have been filed against 21 cops involved in the killing of Calbayog Mayor Ronaldo Aquino.
And China says it has administered more than 1 billion doses of its COVID-19 vaccines, but experts weigh the efficacy of China's vaccines.
Good evening, Philippines and the world. Today is Monday, June 21, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am Kat Dumaraos.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The mandatory wearing of face shield outside of residence is no longer required, according to Malacanang. But further details will be announced tonight by President Rodrigo Duterte if he would let the face shield policy remain in crowded and enclosed areas. Rosalie Cons reports why.
Malacanang reveals that it is no longer mandatory to wear face shield when going outdoors. Authorities also should not apprehend people if they only wear face masks when going out. However, presidential spokesperson Harry Roque clarifies President Rodrigo Duterte is yet to decide on the appeal of the Interagency Task Force to keep the face shield policy in enclosed and crowded areas.
So yung hindi naman po inapila, that's immediately executory at kaya nga po yung immediately executory yung face mask na lang po paglalabas po tayo. Except for sa public transportation at saka dun sa mga enclosed or di naman kaya yung mataong lugar gaya ng public markets.
President Duterte is expected to announce his decision on the IATF appeal tonight. IATF wants to retain the mandatory wearing of face shield in hospitals, schools, workplaces, commercial establishments, public transport, terminals, and places of worship.
Hindi na po kinakailangan ng face shield sa labas kasi hindi naman po inapila yan ng IATF. Ang inapila lang ng IATF yung pagsuot ng face shield sa loob kasama na po sa mga malls at iba pang mga commercial establishments at saka sa mga pampublikong transportasyon.
Last week, the chief executive said face shields should only be worn in hospitals. It was in December 2020 when the IATF began to impose the mandatory wearing of face shield in all public places. Rosalie Coz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, in his tweet earlier this evening, presidential spokesperson Harry Roque tweets otherwise. He says that acting upon the advice of health experts and in view of the Delta variant, President Rodrigo Duterte has declared that the wearing of face shields, both indoor and outdoor, remains mandatory. The palace official said in his media briefing today that the face shield policy will be discussed in the president's public address tonight. 4 more cases of the highly contagious Delta variant of COVID-19 that first emerged in India have been detected in the Philippines. Authorities are now scrambling to prevent the entry of the Delta variant in their respective areas. Aiko Miguel explains why.
Stricter border controls are now implemented in airports, ports, and even in borders of each areas in the country. According to the Department of Health, this has been decided by the government so that the country will not experience the COVID-19 surge like in India that was caused by the Delta variant.
Lahat po tayo ngayon ay nasa heightened alert po lahat. Lahat ng local governments were informed. Lahat po ng mga regional offices were informed na kailangan bantayan maigi ang Delta variant across our borders.
Strengthened travel ban, testing, quarantine, isolation, and faster contact tracing efforts are ways to prevent the rapid spread of Delta variant in the country.
We are going to uphold the directive of the IATF as well as the Office of the President. This is because we want to prevent further entry of this Delta variant. We cannot have non-uniformity in the implementation of our border control. So yan po ang pinag-usapan, yan ang napagkasunduan. Nakausap na rin po ng ating mga officials, ang ating mga regional directors ng iba't ibang ahensya sa Cebu last Saturday.
The situation could be worrisome if the Delta variant becomes dominant in the country. This will bring cases to thousands per day, especially in the NCR plus areas. If this happens, hospitals will again be overwhelmed. There will be shortage in manpower, and hospital and facilities will again be full. According to the DOH, a person positive of the Delta variant has more chance getting hospitalized compared to other COVID-19 variants.
Walang sinabi sa mga ebidensyang nakalap natin, and even our experts are saying walang sinabi na deadly, pero sinabi niya mas nakakahawa talaga siya. Ang Delta variant is 60% more transmissible than the Alpha variant. So ibig sabihin po, kung ang Alpha variant ay nakapanghahawa ng mga 4 hanggang 5 tao for every individual infected, ang Delta variant po can have about 8 individuals infected sa isang taong may sakit. So ganun po kabilis lumabo ang pagkakahawa-hawa kapag Delta variant ng pinag-uusapan.
Currently, there are 17 Delta variant cases in the Philippines. As of today, there are 40 new cases of various COVID-19 variants in the country. Based on the biosurveillance report of the DOH, UP National Institutes of Health, and UP Philippine Genome Center, 4 of the additional cases are Delta variant, 14 are Alpha variant, 21 Beta variant cases, and 1 Theta variant, which is not considered as a variant of concern. The newly recorded variant cases in the country have no travel history in India, but they have traveled in different countries. The DOH once again reminds the public to responsibly observe the existing health protocols in the Philippines to avoid getting infected with any COVID-19 variant, especially Delta variant. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Metro Manila Council intensifies its preparations against the possible spread of the COVID-19 Delta variant. The NCR mayors also agree that the turnover of returning Filipinos from the quarantine facility to the local government remains critical. Asher Kadapan Jr. tells us why live. Yes, Asher.
Arlene, Filipinos who arrive in the country should strictly serve the full quarantine days as mandated by the Department of Health to avoid the spread of COVID-19 Delta variant in the country. Should they yield negative in the COVID-19 test on the 10th day of their quarantine period, returning Filipinos will be turned over to the receiving local government unit to complete the 14-day quarantine protocol. But Metropolitan Manila Development Authority Chairman Benjamin Benhar Abalos Jr. emphasizes that appropriate quarantine protocols should still be observed. The Metro Manila mayors, however, all agree to stringently monitor the returning Filipinos and make sure that they remain inside the quarantine facility or residence.
So while they are having their quarantine in hotels o kung saan man, it is very important na sana walang makalabas. Baka kasi yung iba pinapalabas, kumain sa labas, mag-grocery, these kinds of things. It is very important right now that we be very strict with protocols.
The local chief executives, on the other hand, are also continuously preparing for another possible surge in the COVID-19 cases. This includes augmenting the contact tracers in local government units in Metro Manila.
Si Secretary Bello before, binigyan kami ng 15,000. Ang nagagamit namin ay 5,000 pa lang if I'm not mistaken. So we still have 2 months. I think it's July and August. 5,000 each for every ini-stretch namin Imbis na gamitin namin yung 15,000 for just 1 week or 2 weeks, ginamit namin for 3 months.
COVID-19 facilities, hospital beds, and equipment are also being prepared in case the spread becomes inevitable. Border control for international entry are heightened, particularly in airports and piers. The MMC, however, appeals to the public to do their part by observing the minimum health protocols. Abalos also advises any person who may feel any symptoms of the disease to stay at home and isolate themselves immediately. Arlene?
Thank you, Asher Kadapan Jr. reporting live.
Meanwhile, the Iloilo City government is now appealing for the deployment of more health workers and COVID-19 vaccines in the city. Janice Inhente will tell us why live. Yes, Janice, good evening. Go ahead.
Yes, William, Mayor Jerry Treñas is now appealing to the national government for help as spiking cases of COVID-19 is gravely affecting the social economy of Iloilo City. As of June 22, DOH Region 6 recorded a total of 2,561 active cases of COVID-19 in Iloilo City. The city has been averaging around 100 new COVID-19 cases per day since last week of May. Both public and private hospitals have reached its capacity, as many there have been problems in getting COVID-19 beds as well as lack of equipment and medical supplies. Mayor Treñas is asking the DOH for augmentation of health personnel to the hospitals and other health facilities, as some of the medical frontline workers are either infected with COVID-19 themselves or are physically exhausted.
Ang hingi ng mga hospital is 125 personnel, nurses, no? Nagbigay ang DOH 60 nurses. But they have informed already the hospitals that these nurses will be only up to June because wala na silang pera daw. So I will be writing Secretary Duque na kung pwede, sana naman pagbigyan naman ang Iloilo. Kailangan namin talaga ng nurses para sa mga hospital.
Treñas also reiterated to the national government the need for more vaccines for the city residents.
You know, you cannot stop people from getting up now. People are out of jobs. They need money to buy food for their families. The only way we can really stop the surge is for the national government to add more vaccines. In the same way that you lower the cases in the NCR plus 8 by flooding the LGUs in NCR plus 8 with vaccines, I think you should do the same thing.
So far, almost 40,000 people in Iloilo City with a population of almost 475,000 have been fully vaccinated. William?
Yes, thank you very much, Janice Inhente, for that live report. And the Department of Health, or DOH, said more than 300 medical personnel will augment the manpower of hospitals in Western Visayas, including Iloilo City. The DOH ensured that the additional vaccines will be provided to areas with rising cases of COVID-19.
I just like to ensure everybody that meron naman ho tayong binibigyan sa bawat lugar, at kasama nga po sa prioritization framework natin, ito pong mga lugar na matataas ang kaso. So kasama po dyan ng Iloilo City.
Meanwhile, the Department of Health reported 5,249 new COVID-19 cases today. This brought the total number of COVID-19 cases in the country to 1,364,239. The DOH case bulletin also showed 7,053 new recoveries and 128 new deaths. The total number of recoveries rose to 1,284,643, while total deaths climbed to 23,749. The DOH said 23 duplicates were removed from the total case count, as 16 of these were recoveries. The Health Department said all labs were operational on June 19, 2021, while 8 labs were not able to submit their data to the COVID-19 document repository system.
The government is confident the Philippines can reach its vaccination rate target of 500,000 COVID-19 doses per day. Meanwhile, medical experts from Israel are now in the Philippines to help the government fight COVID-19. Rosalie Cos explains why.
The Philippines have administered 8.40 million doses of COVID-19 vaccines as of June 21, 2021. On June 15, the country recorded the highest daily vaccination rate at 322,929 doses. According to presidential spokesperson Harry Roque, now that the government has already secured 40 million doses of Pfizer-BioNTech vaccines, the Philippines will be able to administer 500,000 doses every day once the vaccine supplies start to arrive in August. The government aims to inoculate 70 million adult population before 2021 ends.
Kung 500,000 per day po yan, 10 days is 5 million. So kinakailangan lang po natin 20 days para po maubos yung first dose ng dumating na 40 million na Pfizer.
In total, the Philippines is expecting 158 million doses of vaccines this year. Meanwhile, the country targets to adopt the vaccination program and deployment of Israel. 3 Israeli medical experts are now in the Philippines to share their experiences.
Siguro po importante pagbisita nitong ating mga kaibigan galing sa Israel dahil nais din natin magkaroon ng maskless Christmas.
The National Task Force Against COVID-19 will meet with the Israel medical team. They are also scheduled to visit some vaccination sites in the country. Israel is the world's leading country on COVID-19 vaccination, in which more than half of its population have been vaccinated already. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
China became the first country in the world to have administered 1 billion doses of COVID-19 vaccines. Meanwhile, some people in Singapore began receiving the COVID vaccine manufactured by the Chinese company Sinovac, but top health officials cast doubt on its effectiveness. This report will tell us why. China has administered more than 1 billion doses of coronavirus vaccines, the country's health authorities said on Sunday. This figure accounts for more than a third of the shots given across the world. While it remains unclear what percentage of the country's nearly 1.4 billion people have been inoculated, authorities have set a target of fully vaccinating 40% of the population by the end of June. China's 1 billion doses landmark was crossed soon after the 2.5 billion milestone was surpassed globally on Friday. After a shaky start to its inoculation campaign in December 2020, China is pushing for a more aggressive vaccination strategy. Different measures like free vaccines or special perks have been ordered to encourage more residents to take the shot. Meanwhile, Singapore allowed 24 private health clinics to administer the Sinovac vaccine after the World Health Organization authorized it for emergency use earlier this month. But even though initial demand for the shot appeared to be strong, Singapore's government has so far stopped short of adding it to the national vaccination program. Kenneth Mack, Singapore's Director of Medical Services, said evidence from other countries showed people who had taken the Sinovac vaccine were still getting infected. More than a third of the city's 5.7 million people have been fully vaccinated, and nearly half have received at least one COVID-19 shot. The government expects to complete vaccinations by the end of the year. Kat Maraos, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
Davao City Mayor Sara Duterte thumbed down a possible tandem with her father, President Rodrigo Duterte, should she decide to join the presidential race next year. Meanwhile, Senate President Vicente Soto III and Senator Panfilo Lacson are considering running in tandem in the 2022 national elections. Nel Maribohok reports why.
Davao City Mayor Sara Duterte said it is unlikely that she would be chosen as the running mate of her father, President Rodrigo Duterte, who earlier detested the idea of having a woman as the next president of the country.
Nag-ingon na si President Duterte, di ba, na the presidency is not a woman's job, particularly not for me, di ba? So, maudagan si President Duterte ug Vice President. So, let's not expect na ako ang iyahakuhaong president.
Some personalities who are in talks with Mayor Duterte regarding the vice presidency are former Defense Secretary Gov't Teodoro, former Senator Bongbong Marcos, and House Majority Leader Congressman Martin Romualdez. Meanwhile, Senate President Vicente Sotto III, acting chairman of the Nationalist People's Coalition, is willing to campaign for Senator Panfilo Lacson to become the party's standard bearer in the 2022 elections.
Wala pa sigurong percentage na masasabi, kundi we are seriously considering it. I think my consultative meetings or consultations will help a lot.
According to Senator Soto, the party's officers will go around the country to get the sense of their members about the 2022 polls, including their possible candidates. Liberal Party President Senator Francis Pangilinan emphasized the need for the opposition to unite and come up with one presidential candidate that will go against the administration's candidate, as what Vice President Leni Robredo said. According to the senator, if there are 3 or 4 candidates in the presidential race, there is a big chance that the administration will still win the elections. Also, the LP president said if VP Leni decided not to run as president, the party is ready to talk with other possible candidates who are not party mates. Meanwhile, some of former and re-electionist senators are once again gearing for the senatorial race. According to the Senate President, these include his party mates Sorsogon Governor Chis Escudero and Antique Representative Loren Legarda. Also, other familiar names like former Senator J.V. Ejercito, Bam Aquino, Gringo Onasan, and re-electionist Senators Sherwin Gatchalian, Joel Villanueva, and Mig Subiri, who are all preparing to enter again the senatorial race in 2022.
Alam ko, they are going to run for election for the Senate.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine National Police said administrative cases have been filed against the 21 policemen involved in the killing of Calbayog City Samar Mayor Ronaldo Aquino. The PNP Internal Affairs Service targets to give their recommendation on the case to the Chief PNP within 20 days. Lea Ilagan files this exclusive report.
The PNP Internal Affairs Service is now in the summary dismissal proceedings on the case filed against the 21 cops involved in the death of Calbayog City Mayor Ronaldo Aquino. PNP Internal Affairs Service Inspector General Attorney Alfigar Triambolo says cases of grave misconduct and irregularity in the performance of duty were filed against 8 cops, including Police Lieutenant Colonel Harry Socaire, Police Lieutenant Colonel Cyril Tan of the PNP IMEG Visayas. Meanwhile, grave irregularity in the performance of duty were filed against 11 police officers from the Regional Drug Enforcement Unit due to failure to follow the PNP operational procedures in conducting operations. Less grave neglect of duty is also filed against Police Colonel Michael David, the Director of PNP IMEG Visayas, and Police Lieutenant Colonel Neil Montaño of the Regional Intelligence Division of Pro 8 due to command responsibility. Attorney Triambolo said policemen will be immediately dismissed from the service if proven guilty.
Ang nawala nila ay yung kanilang pagkakaroon ng benefits, yung iba pang mga benefits nila na dapat tanggapin kung sila po ay nasa actual na serbisyo, kung sila po ay nag-retire. Sila po ay forfeited na po yung kanilang eligibility. Hindi na po sila pwedeng mag-empleo ng lahat ng tanggapan ng ating gobyerno. So they are practically disqualified.
Attorney Triambolo also noted that they will finish the hearing of the case within 20 days and immediately submit a recommendation to PNP Chief Police General Guillermo Eleazar.
Ngayon ay sila din ay nagkakaroon ng tatawag na pre-charge investigation o titignan kung may sapat ba na basihan para isampa po ang mga asunto laban sa mga pulis na involved sa insidente na yan sa Calbayog.
On top of the administrative cases, 7 cops are also facing murder and frustrated murder complaints filed by the National Bureau of Investigation. This after Police Master Sergeant Jose J. Senario admitted in a Senate hearing that the police conspired with Aquino's political opponent to involve him in illegal drugs. He even said that the mayor's murder was being planned a long time. On March 8, Aquino died in an ambush at around 5 p.m. in Barangay Lunoy. Initially, the police report said that unidentified motorcycle riding assailants shot the victim along with his 2 bodyguards. But a day after the incident, the PNP clarified that Aquino had died in a so-called shootout. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Some groups and individuals who were recently tagged as terrorists by the Anti-Terrorism Council have not yet shown their intention to be deleted from the list. Dante Amento tells us why.
Anti-Terrorism Council or ATC spokesperson Undersecretary Adrian Sugay says they have not yet received applications for delisting from individuals, groups or associations that were designated as terrorists. The ATC is also drafting its internal mechanism for designation, which contains additional provisions over delisting. On May 13, the ATC made public its resolution number 17, which designated 19 supposed members of Communist Party of the Philippines Central Committee and the New People's Army as terrorists. Among in the list is CPP founder Joe Masison, his wife Julieta Sison, and other high-ranking officials or National Democratic Front peace consultants. The ATC designated the CPP-NPA as terrorist group in December 2020. In a separate resolution number 16, 10 other members of the Bangsamoro Islamic Freedom Fighters and Abu Sayyaf group are included in the list of terrorists. Under the implementing rules and regulations of Republic Act 11479 or the Anti-Terrorism Act of 2020, a designated terrorist may request delisting before ATC within 15 days of the publication of his name. The section also lists 6 grounds for delisting and how frequently the appeal may be filed. If the application is approved, the ATC will also issue a resolution that a person, organization, association has been delisted or deleted from the list, and the resolution will be published or posted online through the official gazette or newspaper and the ATC official website. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, thousands of protesters call out Brazilian President Bolsonaro to resign as citizens lament over the increasing COVID-related deaths they call a genocide. Marvi Delphine will tell us why live. Yes, Marvi?
The streets of Rio de Janeiro were filled with thousands of anti-government protesters on Saturday to demand the resignation of Brazilian President Jair Bolsonaro as the citizens witnessed Brazil's COVID-related death toll reach the 500,000 mark.
O fato da gente estar aqui, todos contra Bolsonaro, a gente não está esperando a próxima eleição. A gente quer tirar ele agora.
The protest showed its people cry in grief, lamenting over the government and the president's tragic handling of the COVID-19 pandemic. Protesters are calling it genocidal as they see their people increasingly suffer against the virus.
A gente está fazendo protesto contra esse governo Bolsonaro, genocida, que não comprou vacinas e não fez nada para cuidar da gente nesse último ano.
President Bolsonaro has been accused multiple times of downplaying the pandemic. Not only has he refused to get vaccinated against the virus, but he has also consistently resisted containment protocols, even refusing the use of masks himself. 20-year-old student Isabella Guljor, who joined the protest in Rio, has emphasized how Brazil is well known for its vaccination qualification. Yet its vaccine drive against COVID-19 has not lived up to expectations. Currently, only 11.4% of the 212 million Brazilians have been fully vaccinated, and the country is now second place in the world for the highest death tolls related to COVID-19. Elsie?
Marvi, we know about those multiple protests against the leadership of Jair Bolsonaro in the past and present. How do all these protests affect his approval ratings?
Elsie, with all these multiple protests against President Jair Bolsonaro's COVID-19 management, 45% of the country's citizens now think that his leadership is bad, compared to December 2020 when only 32% of the people did not approve of his leadership. Back to you, Elsie.
Thank you, Marvi Delphine, live from Perth, Australia. The Biden administration is moving to make gender confirmation surgery a possibility for transgender veterans. Maeve Dog will give us the details live. Maeve?
LC Veterans Affairs Secretary Dennis McDonough announced on Saturday at the Orlando Vet Center in Florida the U.S. government's plan to offer gender confirmation surgery to U.S. transgender veterans through the Veteran Affairs healthcare coverage. McDonough said they are taking the first steps to expand the coverage of the Veteran Affairs or VA health benefits package, which currently excludes funding for gender alterations. According to McDonough, the decision was made based on the recommendation of clinicians and will impact the healthcare of transgender veterans physically and mentally. Furthermore, he stated that it was ultimately President Joe Biden's decision to include funding for the surgery in veteran health benefits and is part of the Biden-Harris administration's effort to make diversity and inclusion a priority. The National Center for Transgender Equality estimates the number of transgender U.S. veterans to be 134,000. Elsie?
Maeve, what benefits are the U.S. trans vets currently receiving through the Veterans Affairs Health Benefits Package? And how is the government moving forward with this plan?
Yes, Elsie, currently the Veteran Affairs Health Benefits Package covers mental health services, hormonal therapy, preoperative evaluations, and long-term post-op care. This announcement, Elsie, is just the beginning of the process. Policy changes are required in order for gender confirmation surgery to be covered by Veteran Affairs healthcare and to be included in coverage that VA hospitals in the U.S. offer. The cost to Veteran Affairs is also currently unknown. Adding to that, Elsie, the process of creating a new federal regulation for this can also take years. But it is expected to begin this summer in the U.S. and will provide a period for public comment. Back to you, Elsie.
Thank you, Maeve Dog, live from Kingaroy, Queensland, Australia. Meanwhile, the United States sent 2.5 million doses of the COVID-19 vaccine to Taiwan on Sunday, tripling an earlier pledge in a donation as the island battles another COVID-19 outbreak. China, which considers Taiwan an integral part of its territory, has repeatedly offered to send coronavirus vaccines to the island, but Taipei has expressed concern about the safety of Chinese shots and accused Beijing of blocking its efforts to purchase vaccines internationally. Taiwan was previously heralded as one of the world's success stories in controlling COVID-19, but has now reported 14,000 cases and 538 deaths, according to the island's Center for Disease Control. On her social media account, President Tsai expressed her gratitude to the Biden administration and the bipartisan U.S. Congress for their support. A 14-year-old girl strikes her third time of being diagnosed of cancer feeling disappointed and scared after fighting it off twice already, while her mom had to make a tough call to postpone her own life-saving treatment for her kidney diseases to prioritize her daughter's leukemia treatment. Nina Bascon reports why.
Shay Wignall, at the age of 11 back in 2017, was first told that she was suffering from leukemia. And in order to treat the illness, Shay and her mother, Jules Keith, had to move 200 kilometers from Bendigo Central, Victoria, to the Royal Children's Hospital in Melbourne, Victoria, to receive treatment. Leaving her loved ones behind, the 14-year-old teenager and her mother, Jules Keith, were both away from home for 8 months because of Shay's first fight with the disease, while 5 months for the second, and now are about to take off for the third round of treatment this year. Shay admits that because of this, she misses quite a lot of things as a normal kid.
There's a lot of things that I miss. I miss my room. I miss just being me. I really, really miss my family. My dad, my brother, my cat, Podge. She counts as family. And just being a normal kid and playing with my friends and just seeing my brother.
While Shay is battling leukemia and is expected to receive a bone marrow transplant using cells donated by her biological father, her mother, Jules Keith, herself is also suffering from a tough condition of stage 5 chronic kidney disease. Jules was originally scheduled to have her own vital transplant this year, but have elected to put it off until her daughter completes her latest round of treatment. She stated that right now, Shay is her priority. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
A bill seeking to promote and protect the welfare of workers in the media is awaiting the Senate's approval. House Bill 8140, authorized by ACT CIS Representative Nina Taduran, aims to provide enhanced protection, security, and benefits for media workers. The proposed Media Workers Welfare Act seeks to ensure that media workers shall, at a minimum, be paid the wages, allowances, and benefits provided by law to workers. According to PCOO Secretary Martin Andanar, Senate President Tito Soto has already committed for the consideration of the bill.
Because we believe that the security of the media is not limited to your, yung bodily harm na gusto nating maiwasan, including welfare, security ng mahanap buhay.
Meanwhile, Manila City Mayor Isko Moreno Dumagoso said they are allowing again walk-in clients at vaccination sites. The first come, first serve or open policy will also take effect again. JP Nunez will tell us why.
As of 4:30 this afternoon, only 4,402 of the 28,000 residents texted for their schedule went to vaccination sites in Manila to receive their first dose of COVID vaccine. Only those who have received text message of schedule from the Manila COVAX were allowed to get inoculated. It resulted to a low turnout of vaccinees and all vaccination sites seems empty in the afternoon.
Ngayon po sa makikita ninyo, dapat po mga ganitong oras, from here po talaga puno yan at meron pa po sa labas mga nakaupo. Ngayon po sa oras na to, makikita nyo ilan-ilan lang po ang pumapasok. Bakante po dito at saka sa susunod na room.
Last week, as early as 7 a.m., mall vaccination sites were already in cut-off due to the massive number of residents who want to receive COVID vaccine. With the low turnout, Manila City Mayor Isko Moreno Dumagoso decided to lift the no walk-in policy.
But if we're going to continue doing the old thing that doesn't give result, then it will defeat the purpose. We have shown you today, palpak talaga. Palpak po. Ako na po ang palpak po yan. Ayan po. Pangalawang beses na yan.
In just 2 hours after lifting the policy this afternoon, the Manila City LGU already vaccinated around 7,000 individuals. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
And around 300 schools may participate in the pilot testing of the limited face-to-face classes, according to the Department of Education. Marvin Calas reports why.
1,900 schools were first recommended by the Department of Education to undergo pilot testing of face-to-face classes for the next school year. Due to the large number, DepEd eventually trimmed it down to 300 schools. But because of the possible threat posed by the Delta variant, Department of Education Secretary Leonor Briones clarified that the numbers still depends on the approval of the President and other concerned agencies.
But it depends on the assessment of the IATF and the Department of Health, because as you know, a few months back, the President already agreed that we would have the pilot studies for the schools that we recommended, and then UK variant came in. Now we have to deal with the Delta variant, which I understand is very virulent.
The official says the department's primary concern on the expected class opening is the safety of the students and faculty members. DepEd also assured that the education sector adapts to the changes in order not to compromise the learning system for the students. It includes the refining of K-12 curriculum, the integration of subjects, and to adopt flexible learning even after the pandemic.
What was really very obvious was the congestion of the learning competencies. So what we're trying to do now is to come up with a set of learning competencies that will not be very congested, but more focused on the foundational, fundamental skills that the children need for them to become independent learners in the future.
Furthermore, the department recommends 3 school opening dates, including August 23 and on the 2nd or 3rd week of September. DepEd also noted a high number of early registration this year for students under kindergarten, grades 1, 7, and 11 that reach more than 4.5 million. Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
A COVID-19 ranking on resiliency showed that countries in the Asia-Pacific region dropped due to increasing infections and lockdowns. However, Western countries have climbed the list as vaccination increases. This report will tell us why.
New Zealand once again gained a top spot on the COVID-19 resilience ranking of Bloomberg last month. The ranking studies the effectiveness of COVID-19 responses of 53 nations across the globe with the least social and economic disruption. According to the report, New Zealand has been able to contain the virus, allowing its citizens to go back to almost a pre-pandemic life, except from international travel. However, the country has recorded only a 5% vaccination rate in May. Singapore went down a notch after it placed second from being the top notcher in April. The report cited its imposition of lockdowns and resurging COVID-19 cases. Other Southeast Asian countries, including Taiwan and Japan, that dropped out of the top 10, Malaysia, Thailand, and Vietnam, also suffered the same amid slow vaccination drives. The Philippines went up, placing 43rd on the list from April's 45th. However, it remains the last Southeast Asian nation on the list. United States and several European countries, meanwhile, climbed places as quarantine restrictions eased up and vaccination rates continue to increase. With the rate the vaccine rollout is going, Bloomberg projects that it would take years for some Asian countries to achieve herd immunity, 4 years for the Philippines, while 6 to over 10 years for Taiwan, Bangladesh, and Vietnam. The report noted that the ranking, since its conception in November, showed the divide between the rich and poor nations in vaccine access, and the disparities pose a threat to the world as the danger of new developed mutations lingers. It added that the success in containing the virus relies more on governments fostering a high degree of trust and societal compliance. The report added that when citizens have faith in the authorities and their guidance, lockdowns may not be needed at all, just like what Japan and South Korea showed through most of 2020. In the Philippines, the government has repeatedly defended its COVID-19 response against critics, with presidential spokesperson Harry Roque saying at one point that it has been excellent. It also denied the allegation that the government neglected the provinces, which resulted to surges in regions.
Kumakalat pa rin po ang COVID dahil hindi po sumusunod ang ating ilang mga kababayan doon sa pakiusap na ating presidente na mag-mask, hugas at iwas. Bagamat, sabi nga po ng presidente, yung mga lugar na tumaas ang kaso, magkakaroon po ng mas maraming bakuna.
Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, June 21, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. Sitting in for Diego Castro, I am Kat Dumaraos, live from Bangkok, Thailand.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.